Well, interesting enough, I've just been teaching a course in Australia with Susie, who's one of our more senior faculty members. She's a physiotherapist. She's been doing physiotherapy for 30 plus years. She's been doing the CHEK system for nearly 30 years. And she actually was talking to me and saying that what she recognized when she first saw the CHEK system is that actually a lot of it is taught in the world of physiotherapy. In fact, most of it is. There's some elements that aren't. But a lot of the assessments that we do are physio-based assessments. But that actually what's happened is that physios have just been lazy. And that's nice to hear coming from a physio, because that's kind of how I feel about osteopathy and other manual therapists, is that we are caught in a system where we have to do very focal, quick diagnostic assessments, come up with some kind of reason for why the person has pain, and then work to that diagnosis and treat and advise based on that diagnosis. And the reality is that if you try to do that in 30 minutes, which is quite a common duration for many of these assessments, sometimes people will have a little longer, sometimes a little shorter. But what it means is that you're really taking a best guess approach, and you're not assessing the whole system. You're not really understanding what's affecting what. And so in the CHEK system, of course, what we do is we take a more structured approach, and whether someone's got low back pain or whether they've got neck pain or shoulder injury, we're going to be looking at their feet, we're going to be looking at their knees, we're going to be looking at their hips, measuring all of the different ranges of motion throughout the body. We're going to be looking at their spinal inclinometry, we're going to be looking at their core function, looking at their digestive system, looking at their entire hormonal and visceral function, as well as their emotional history. So when we have that assessment process in place, what it means is that we can actually look at the person overall, and rather than focusing in on the symptomatic area, we can say, well, what's going on in this body and what points towards that symptomatic area and why it's under stress. And so I think if you have physios, osteos, chiropractors, other manual therapists following a more structured system and just allowing themselves the space to be able to screen the whole body, what you start to see is the patterns that are contributing to the symptom profile, rather than going into the symptom and saying, okay, let's treat this symptom here and see how the person responds to it. So I think the net effect would be that you can address more the causation of it if you have a more structured assessment process like we use in the CHEK system, and it allows you to move away from a more symptom-based, let's say more reactive approach. So for me, that's more ethical, is to address the cause, to be able to work preventatively, and in doing that, of course, that alleviates the symptoms.